Hello everyone. Today we're going to do a focus assessment on the respiratory system. So what you would do is do the examination, which starts from inspection, then you would proceed to palpation, then percussion, and then lastly auscultation. So before you begin, you would introduce yourself to the patient, introduce your name and your designation and what you would do to the patient. And then also gain their consent when doing the examination. And then after that, you would begin preparing your supplies. Get ready what you need. Like for this one, you would need your stethoscope, and then you would do hand washing, and sometimes you would need gloves, and you would also provide privacy when you're doing examination to your patient. So you would begin with doing the inspection. So you would inspect the anterior chest of the patient, and you would observe for the breathing of the patient if there is fast, slow, or normal breathing. You would also inspect the skin color if there are any abnormal changes, color changes, and any condition or any contractions that the patient might have. Same thing with the posterior chest. You would observe the bilateral expansion of the chest, and also note the presence of the cervical spine or the spines, the vertebral spines, it leads in the midline. And note any abnormalities that you may observe on that. Next, you would do palpation. So basically, you would use your hands to palpate the patient, and you would palpate and check for any masses, lumps, or tenderness along the chest walls or around the chest region of your patient. Also, you would note the breathing if it's bilaterally symmetrical. Same thing with the back. And then you would also do the diaphragmatic expansion. So what you would do is you would place your two fingers, the base of the lungs, and see if both fingers would arise as the patient inhales. Same thing with the anterior. You would also note for the equal movement of the hands while they are breathing. Next, you would do percussion. So basically, you would do the tactile. Before all that, we would do tactile thermometers. So we would basically check for the resonance and ask the patient to say 99 while we palpate them.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay. So basically, you would want to know if the patient has dullness in the sounds or equal sounds on both sides, and usually this is present with diseases like COPD or asthma, and you would note the difference of the sounds on the two sides. Next, you would do the percussion. So basically, you would use two hands. You would place one hand on the patient, and the other would percuss the bony prominence of your hands or the metacarpals, and click for resonance of the sound. Then ask the patient to turn around and do the same thing on the anterior chest. So some patients might have a bariatric case, so you might have to move their breast and have them inhale for a bit and then do the percussion. And then when you do the percussion of the heart, that's when you would usually normally hear the dullness. And then lastly, you would do the auscultation, so you would use the stethoscope to look for abnormal breath sounds. So basically, when we do auscultation, you would normally want to hear three normal lung sounds, which are your bronchial sounds, bronchiovesicular sounds, and the vesicular sounds. Your bronchial sounds are normally heard on the trachea region and the neck region. And then next, the bronchiovesicular sounds are normally heard lateral to the breastbone, so around here. And then lastly, the vesicular sounds are normally heard on the chest region around here. Same thing on the back. So let's start. You would use the diaphragm and ask the patient to breathe in. Okay, and then on the back. So basically, when you're doing auscultation, you would want to take note of the abnormal breath sounds such as your wheezes, crackles, rails, and stridor. After that, you would answer any questions that the patient might ask you and provide health teaching and education with regards to respiratory system. That's all for now, and thank you.